Good evening. My topic is analysis of radiological features, systemic risk factors and treatment outcomes in dacryoadenitis. Dacryoadenitis is the inflammation of lacrimal gland. Patient present with features of inflammation with a global incidence of 1 in 10,000 ophthalmic cases. On examination, you will see enlarged and erythematous lacrimal gland. Causes can be many, infectious or non-infectious. Radiology shows lacrimal gland enlargement with sometimes involvement of extraocular muscle, intraorbital fat or paranasal sinus. Treatment is based on etiology of the disease. The aim of my study was to analyze the radiological features and to correlate with the systemic immunological risk factors and to evaluate the treatment outcomes in dacryoadenitis. It was a retrospective observational study conducted in tertiary eye care center. Patients with the diagnosis of dacryoadenitis for a 2-year period were selected. Inflammation secondary to thyroid eye disease, neoplasm and trauma were excluded. So, the patients diagnosed clinically as dacryoadenitis were selected. Demographic details, systemic and ophthalmic history was collected. All the patients have underwent CT orbit and image was analyzed for the involvement of lacrimal gland, extraocular muscle, orbital fat and paranasal sinus. Blood investigations were sent to look for serological immunological markers. Patients were started on systemic steroids and on day 3 response was analyzed. And it was categorized as no response, complete response or moderate response if the response was in between first two. Rheumatology opinion taken if serological markers were positive. Further follow-up were done on week 1 and week 3. So we got a sample size of 50 with mean age group of presentation as 48.32 years and females were predominantly affected. Looking at the blood investigations, 37.5% of the patient had elevated anti-nuclear antibody, 33.3% had elevated serum IgG4, 16% had elevated serum angiotensin converting enzyme, 7% had elevated RA factor, and none of the patients were positive for anti-neutrophil cytoplasmic antibody. Looking at the radiology, out of 50 patients, 21 had extraocular muscle involvement, 8 had bilateral lacrimal gland involvement, 6 had intraorbital fat involvement, and 2 had paranasal sinus involvement. Lateral rectus muscle was the most commonly involved muscle in patients with dacryoadenitis. Looking at the radiological imaging of IgG4 positive patients, out of 9 patients, 5 had unilateral lacrimal gland enlargement, 4 had bilateral, 3 had associated extraocular muscle involvement, 3 had paranasal sinus involvement, and 4 had intraorbital fat involvement. Here we could see that 89% of the patients with serum IgG4 positivity had 2 tissue involvement in radiology. That is either opposite eye lacrimal gland or extraocular muscle or intraorbital fat or paranasal sinus. Similarly, radiological analysis for ANA positive patients were done. Out of 15 patients, 11 had unilateral lacrimal gland enlargement, 4 had bilateral, 3 had muscle involvement, 2 had sinus involvement, and 9 had intraorbital fat involvement. Here also we could see that 93% of the patients with ANA positivity had 2 tissue involvement in radiology. Looking on to the treatment response to systemic steroids, on day 3 and week 1, majority of the patients had moderate response, whereas on week 3, majority had complete response. But for serum IgG4 positive patients, on day 3 and week 1, none of them had a complete response. And even on week 3, majority had a moderate response only. Similar was in case of ANA positive patients. Majority of the patient had a moderate response only during all the follow-ups. So what here to highlight? Radiology helps to assess the extent of orbital tissue involvement in dacryoadenitis. The involvement of lateral rectus muscle can be attributed to the contiguous inflammation from lacrimal gland. Whenever there is multiple tissue involvement associated with the lacrimal gland in radiology, patients are more prone for an immunological cause. Lume, Samran et al. Have conducted a biopsy-based study to look for the specific cause of dacryoadenitis. Here he have found out 61.7% had a specific cause. And in our study also, just looking at the blood markers, we also got a similar percentage of 62. Even though majority of the patients had complete response to systemic steroids on week 3, for ANA positive and IgG4 positive patients, majority had a moderate response. That highlights the suboptimal response to systemic steroids at week 3 warrants an evaluation by a rheumatologist. These are my references. Thank you.
Infective mumps related adenitis, inflammatory related, autoimmune related adenitis, we'll have to differentiate. We'll have to put two subsets. They are not one and the same. Okay. And when this becomes adenitis and when we'll call it as pseudotumor or IOID, we'll have to be clear. So these two factors are not looked upon. Otherwise, it's a good study. You are trying to bring us good inferences, but these two has to be validated also. Okay.
Last time when IgG4 is positive, you must do MRI because you do not pachymeningitis. Those they are asymptomatic. So whenever IgG4 is positive with dacryoadenitis, make sure MRI is done.